taka, max 3 taka, which is instant probably nothing. But get a very personalized, attentive, and very clear health service system, and also the solution on the hands. So we call when you have a mobile phone, you have a doctor. You don't need to go anywhere else.
Great. Thank you. Ursula, advocate, educator, communicator.
Well, to give my story, I told you I'm from a small clinic, but a very, very personal clinic. So people that come to our place are 80% international guests, what we call them. We don't call them patients. And we definitely had the period when the lockdown occurred. This was a very special period because we had about 60 patients in our house, and they all just landed 2-3 days ago, and we had to tell them, we're sorry, you have to just turn around and go back where you come from, because we're going to go into lockdown and we cannot keep you here. So why am I telling you this story? I think, in my opinion, that one very strong thing happened here. I'm completely with you when you say that anxiety is a big thing. Also, another thing happened. People in the beginning was very anxious. They went back home. Everybody sat at home. Everybody was happy to not connect anymore. But then the second thing happened. We got into trouble because some of the people wanted to get vaccinated. They couldn't get the vaccination. After that, everyone could get the vaccination, and suddenly nobody wanted to get vaccinated anymore. So people got in big discussions, and this is what is also a big thing that I think we really need to work on, that this social interaction was horrendous. I didn't like it at all. You know, it really revealed people are not able to just stand together in such situations, but we just had the problem to keep the whole crowd together and to walk together through this time. So in order to do so, we did it the same way. We implicated telemedicine. We had that for a patient. We were very happy to have had this, we must say. I mean, there's nothing less or nothing sadder than a person that doesn't feel well, that lives in the countryside, and that has nobody that tells him if it's serious or not. It has no voice to talk with him. Nobody that just tells him, maybe try this or try that. So I think that's a very important part in this time. But I also think what was lacking and what I would implicate very strongly is the personal contact is something we can never erase, you know, to really get better. So I'm very happy the time is over. It stays this way. And I do think that we have this seeing them, seeing you, and only need the telehealth in situations where people can't go, to go or live far away, where I think it's a great, great thing.
Where does communication play a role in the work that you do?
Plays a role everywhere. I mean, communication plays a role within the staff. The education plays a role within the staff. The communication within the house is very important. We have, as I said, a lot of international guests, so we have to transport the medical information in different languages, which sometimes is hard. You have to do all the courses, all the speeches in different languages. You have to see that everyone is met by their needs. And if you have different people from different countries, you have different mentalities and different needs. So you have, we have a strong communication within kitchen and a medical service, in between the therapists and the doctors, within the receptionists and the kitchen and the staff, and everyone within communication plays a very big role. And I think the biggest role of communication is the communication with the patient itself. We have a lot of time with our patients, and we try to just add one doctor to one patient throughout the time they're staying with us, which means they're staying between 7 and 21 days with us, and they see their doctor, as we call it, every second day. So we have a very close communication to meet their needs, to explain the records, to really see that they understand, to have a clear diagnosis done, to have a good basis that they understand what kind of therapy would be good for them, and to educate them before they leave us. So this is the thing we do it.
I really like the way all three of you highlighted the way and the path of communication, whether it's by telephone for telehealth, by writing newspaper and publishing in the Dhaka Tribune, the in-person experience to help educate with that communication in person. So, we're coming out of COVID, and many of us now have become more learned in communicable diseases, infectious diseases as one example, like COVID. But there's an increasing emphasis on putting back attention on non-communicable diseases. And I'm wondering for each of you, Malia, if you can start, what non-communicable diseases should we focus on?
Well, there are many. I mean, you have particularly, I think, diabetes and hypertension are rampant, and cancer as well as cardiac diseases. And the other communicable disease that people don't really talk about much these days, I feel should be more emphasized on, is the renal failure. You know, we see a lot of dialysis patients everywhere, all around in the country, but not that many people are talking about it. I think end-stage renal failure is a big problem in the US. They have other programs designed for it. But for even to track non-communicable diseases, what I'm going to say now is like, I'm a big advocate of health information system. So I'm going into that subject now. Because if you don't have the data, how do you take decisions? So health information system is needed everywhere. And I see in the private hospitals, corporate hospitals, it's already there. And as we spoke of telehealth, telehealth also has a feature of keeping the medical records in the system so that it can be pulled out anytime that person is again going for a consultation. So the private entrepreneurs or the private hospitals, they have it, but I feel the government, as usual, has to facilitate this. It has to be made a mandate before it can be widely used. Because let's say, for instance, if I give an example, for a place like in the northern region in Dinajpur, the government decides that, okay, we'll build a cancer hospital there. Whereas it's not needed maybe, because you don't have the region-wide specific data to give you that, to highlight that aspect of it, that particular thing is needed. Maybe you just need I don't know, general hospital, a bigger, like a tertiary hospital. So that thing is needed. And on that, so with the non-communicable disease, thinking that, I don't get to implement a lot of programs because I work in my own organizations. So recently I got to develop a school health program, which I implemented in Jessore, and the local administration, they helped me a lot. And I could do this program in 2 schools. So I designed a web portal with the school health information records that must be recorded there. And the initial data, the initial reports that were coming up, so that also tracked, I made it a point to track what are the non-communicable diseases prevalent amongst the parents. So we saw a lot of diabetes, we saw a lot of hypertension, a lot of cancer. So there are ways of getting the data, but it has to be made mandate. And its NCD is 67% of the burden now in our country, more than the communicable. So we have to track it before we can even make more informed decisions.
Yeah. Super important. So underlying the foundation to that tracking, as you said, just kind of reiterating, information health system is setting up the process of recording and creating a digital system where that can be transmitted across different healthcare areas, be it a hospital, be it a telehealth center, to your primary care doctor. Having a patient portal, meaning you as the patient have access to your own medical information. And one point just to emphasize, both diabetes and hypertension or high blood pressure lead to end-stage renal disease. And what end-stage renal disease is, your kidneys stop working. And when your kidneys stop working, you don't pee. When you don't pee, those toxins build up and there needs to be a way to rid the body of those toxins, and that's when that procedure called dialysis occurs. So Ursula, I want to focus back to your work in the clinic because you see a lot of non-communicable diseases, often chronic diseases, and I'm wondering if you can walk us through some of those common diseases you see and how you approach treatment.
Well, we are, as I said, we're concentrating on the guts primarily. We're always trying to see the patient as a total, and we're asking our patients to bring in the data they have, the medical data, so we can just continue the work and not start all over. But we do have a process that is called a diagnostic principle, where people have the blood taken, where we have different values just checked. And we do have different other specialists that work there, like cardiologists, like gastroenterologists, and neurologists. So we do have the possibility to really make a clear diagnosis. That's the first step. The second step is that many people come here and have diseases where there's no easy therapy. That's why they come. That's why they travel so far. Otherwise, they wouldn't do so. So our job is to really dig deeper and say, okay, is there other laboratory counts that has to be checked? What else is going on? And the one big thing, what we just found, I mean, the clinic's very old. It exists since 1976, and there's a long history in gut, in this kind of gut therapy. We found out that the microbiome is one of the most important things to really check. In the stool, for example, that's the best way to do it at the moment, to really see if there is a barrier problem, so you cannot take up things, or if your immune system is disrupted and things just can enter the body that shouldn't. And we just saw that if you do this kind of check, and there's multiple studies that show that, you can definitely work on the immune system, and this helps in many ways in chronic diseases. Most of all, colitis, ulcerosa, and chronic disease, for example, autoimmune diseases, low immune system. But when it comes to the non-communicable diseases, it's also obesity, it's eating disorders, it's all these things where we always try to work just on the mental basis. But here you can just add a physical therapy, and this helps the people enormous. So what we do, we have two coaches working with the people. If they want, they cannot just do it with everyone. And we have a doctor doing the diagnostic research. And then we add the therapeutic plan and do a restart of the body, which means we clear the intestines completely through, and then we rebuild up the microbiome in a way that the people can restart back home to have a healthier way of lifestyle. When it comes to diabetes, it's very important. When it comes to obesity and eating disorders, it's very important. Just two things, but also gout, also hypertension. We just see people react very fast in the clinic if you just change the diet. And for the people, it's so important to stay there. And these diagnostic checks we have, they're so valuable because they see, oh, my blood sugar count just goes down within 2 days. I thought it ate the same at home, you know. It's not true. You can definitely see it. And this has a very great effect. This education before the people leave gives them motivation to stay on plan, and this gives the positive long-term effect while we have around 70% returns.
This is great. Dr. Nizam, I want to move back to actually communicable diseases and have you highlight a bit your work with Gavi. Feel free to explain to everybody the Gavi organization and what you're doing with vaccines.
Thank you. I think we're talking about communicable and uncommunicable. Very easy, non-health terminology. Communicable is all about getting you touch. You got the disease. That's COVID. That's air. And non-communicable, you cannot really transmit by touching her like that. So, but the world, as she mentioned, world is moving, I'm coming to the vaccine, world is moving towards 71% of the global death as of yesterday is due to non-communicable disease. And primarily cardiac, second is cancer. In Bangladesh, highest is cardiac problem, second is cancer. So, and mental health is an issue now coming with the COVID. So, we need to classify where we will put mental health. It should not fall into the crack. It needs to be seriously addressed in the future. The work I do globally, Gavi is a Global Alliance for Vaccine Initiative. They fund globally all the government and non-government institutions for vaccines. Like in Asian or in European or in North American countries, you see all the basic vaccine for the children, that's all donated by Gavi. Even the COVID vaccine, which is being coming through the different mechanism, which is COVAX. So it's a Gavi-led COVAX, that's WHO, UNICEF, and the partner organization work. So the role of Gavi basically is providing more opportunity for vaccination, and the new vaccines are on the pipeline. We heard today Shara Gilbert talk about that's scaring us actually, those who work in public health, is about the new pandemic. It's very close and very difficult to manage that because predicted pandemic is influenza. And many people do not care about influenza. They don't give attention to the influenza and not creating any sign and symptom. But it has an effect on the organs. So the organ failure will be coming towards the non-communicable diseases. So there is no shortage not to be excited to get more vaccines. And the new vaccine is coming like HPV vaccine, which is for the girls, for preventing the cancer, and the Japanese encephalitis, rotavirus. Another 12 vaccine is going to come in next 3 years' time. And these are all tested, these are all clinical trials that prevent mortality, giving more saving lives in the future. So but the issue is how we communicate that. That's the issue in public health. And that's, we talked about. The vaccine is coming, so what for me? Like in Bangladesh, there's a second booster going on now. People are not coming to the center to take the second booster. But the first and second dose, which is AstraZeneca, is over 80%. Because people are very scared that time. People see every day dying, and the television is scrolling, death. So we need to think about in communication, what approach and how. And probably the lead phase is one of the best examples today to get relaxed, feel about it, think about health, and get the message the way you think appropriate for you. But for the health professional, the way we want to say, people may not like it anymore. Particularly the new generation, the younger people, those who are nowadays the champion of communicating things, when the technology is the prime, where the TikTok is the prime, there are different platforms in the prime. So we need to get out of the traditional thinking of communication to the more advanced but more appropriate and attractive communication, handling disease, and more in exciting way. Not that, oh, this is you cannot eat, but I say always the eat and move, eat and move. That's the non-communicable disease. Eat and move and eat and move. You burn and you eat more, no problem. But you are eating, no burning, so there's a big problem.
Thank you. Can I add to that? He's very right when he says that communication is key and how you communicate. Back in the days, I'm sure you remember that Bragg had that communication of like a fistful of molasses and a bit of salt. You mix it and you recover. That's the rehydration process. So it was widely known throughout the country, through the major televisions. So you need more communication, like drama or something that, you know, that's catchy. I think that's missing.
So as we're coming out of this period of COVID, and all of our audience members are interested in their own health and sort of kickstarting this process, I'd like each of you to highlight ways that each of us can take better care of ourselves and embrace health, thinking of the non-communicable diseases. Ursula, why don't you start?
I just continue with the talk as I said before. For me, the most important point, moreover now, is that we have to be aware that we were just wasting our health before COVID. Nobody really thought about it. We just ate what we liked, we just drank what we found, we worked until the whole night through, we didn't sleep, we sat in front of the laptop, we thought we were superwomen and superman. And I think the most important part is that everyone has to look after themselves to be in a good status. to watch the immune states, to really do the preventive care, to watch for the vaccines, to watch that the food that I have is fitting me, that the movement I have is fitting me. I mean, not everyone is a marathon runner, you know. When we were in the beginning of the first pandemic, the mindset was that everyone has to bring full energy in anything that they did. And I would just say, in order to start better off, we should just try to just step back a bit and be more aware that it could just restart. We should just have an eye on that.
I'm wondering if you can go granular and actually give like specifics. If someone has a pen and pencil out, or they're recording you, or typing it in on their mobile, like, and then they can go home and implement right away.
Very simple things, because not everyone is the same. But what's true for everyone is eat regularly, 3 times daily. Don't overeat, especially with sugar. Sleep more than 7 to 8 hours. Go and have your preventive care taken. Hydrate yourself, but not with black tea and coffee only. That's not the right thing to do. So I think those things are most important. And find your issues, find your medical issues, go to your family physician, have a check done, see if there's any problems with diabetes or hypertension, and let that be set, so you're not starting off in a situation where you're more, you can get more vulnerable for another disease.
I will add to that, actually. I would like to see next 5 years. We know the problem. We're going to run behind these 3 problems, no doubt, in every family, in every country. Non-communicable disease, mental health problem, new vaccine, and also the young generation to protect. These are the 4 things in front of us. Now, how we basically specify the problem, eat and move, the reason why I say we cannot stop it. Now the creative part is we do not need so many doctors in our society. We need so many communicators in our society globally to tell story in a way that people do understand. I, being a medical doctor, when I start my presentation, it's half is not understandable by many of the community. So we need community to say in their own language from the home how to handle the communicable disease. 2 problems if we can handle. One is already mentioned about, Maliha mentioned about the diabetes and hypertension. And this is all about food. This is all about stress. This is all about the health that we want to maintain. So we need to create friends around us to live healthy. And we need to look at our kitchen. I would not say that 3 times diet, eating regularly. I would say, what you eat, please see that. And that's probably the food system would be coming to contribute in the health system. We cannot let the world and food industry to be unchecked anymore, to causing harm and death of populations by the food. We have to, each of the food industry may need to have an epidemiologist, may need to have public health specialists with them, as like pharmaceutical industry. We cannot buy something, eat something, and let people die. No, that's not acceptable anymore in this world globally. So that message, I think I would say, the younger population, those who are, please do what you like to do, but do it consciously. That protect you to live longer and deliver more exciting activities. That probably help you.
I'm going to ask you to go granular. So again, people are looking to like concrete things that they can do. You say look at their food, or take care of their mental health. Can you give specific things they can do?
In the COVID experience, I say mental health is a serious crisis, as I mentioned. Mental health is not something the doctor can really treat. I'm sure many of the doctors who are there, they don't like my statement, but I'm brave enough to say this. Having 16 million people to treat during the COVID. Mental health needs 3 things to address. Do I have a friend whom I can share my pain, whom I can share my difficulties? Do doctor listen my problem? Globally, most of the doctors do not listen the problem details. Except telehealth, probably you can say more comfortably, because they cannot see you even on the phone, privately, and the way you want to say. So what I'm meaning by that, we need a good friend around us We need a good environment at the home to create mental happiness where we can express our interest and interact. That is the one of the things. Food is always a challenge. We should not challenge more, but rather we should really help mom at home. What is the best product we should bring at home to cook? But I would be challenging to the industry, and I'm on the front in Bangladesh and globally to challenge the industry. You cannot sell product that cause harm to the human. I want to buy, I want to be happy, and I want to eat. I don't want to think about that it has something cancerous inside it, for example. So one hand is the policy influence we need, and also we need social influencer at the community, and also all, I think all cohort of population. And we need to create a new space. We need to understand next 3 to 5 years, the global disease and dynamic is going to be changed.
So what I'm hearing is slow down, sleep, eat regularly, don't overeat. I'm also hearing speak with friends, surround yourself with people that can support you, who you trust and love, and move. Just keep moving, don't stop and sit. Concrete items, what can they do for their health?
Well, health is not only a physical thing, it's physical, mental, emotional, and spiritual. So you need all 4 of that. And in terms of physical fitness, I would say exercise, know your food, what you're eating, but don't be so harsh on yourself not to eat the things that you enjoy. Like you like a burger, go eat a burger. You like pizza, go have your pizza. But make sure that the next meal is, more wholesome and everything in moderation. Everything in moderation. And I think what works for me is like I set a parameter, like I have a range that I'm okay if I weigh this much. If I'm beyond that, start working on it. So if you can set a range for yourself, a parameter, I think that helps. And you must also know your familial history. Like, do you have any diseases in the family, whether your parents have diabetes or any such conditions? So be aware of that. Make sure that you don't get it as well, because these are debilitating, and not only because it's going to progress to other diseases, other life-threatening diseases, but it's just like, just manage it. Just know yourself, know what's out there, tell what you're allergic of to your friends, to your family, so that they also know what not to cook or what not to prescribe.
I think it can be overwhelming to know where to start, and I think each of you have given some concrete items. I'd like to open it up now to the audience for questions. And if you raise your hand, then one of our volunteers will bring you a microphone and we'd welcome your questions. Oh, which one? We'll start left to right.
Good afternoon, everyone. Many thanks for the talks, which I was listening to intently. A little bit of background on myself. I'm a doctor myself in the UK, just visiting Dhaka at the moment, so I managed to drop by. My question is, obviously, we live in a global world now. I live in the UK, and I'd be interested to hear what we can learn from each other, specifically. I've heard a lot about, concrete items. I've heard about telehealth, but actually, we can learn from each other. There are things the UK does well, Bangladesh does not. There are things Bangladesh does well, the UK does not do well. Could the panel, coming from your own backgrounds, obviously Austria, Bangladesh, and so on, tell us what is the interdependence about in terms of health things that you think each hemisphere or society does?
Malia, why don't you start and we can go around.
And thank you very much. That's a I think very interesting point. I would be highlighting in a way that in the future world we'll not be living without partnership and collaborations. That's the way I would like to frame. There are certain things in Bangladesh, certain things in the UK, and when I see in Africa, I work there. We need to learn from each community actually, and so blending into places where is applicable for So that's something we need to be, which is calling actually we need to be open enough to learn. And I think COVID has given that opportunity everyone to think about. No one think about mental health before than COVID, and seriously. And also, no one think about that telehealth is so much friendly. From home, I make a phone call and get my solutions. So those are the things needs to, make it more qualitative in a way that can provide preventable solution for population who want to. One other thing I want to add, people, one of the wrong thing in the health industry, and I'm blaming myself being a doctor. When I did practice in my life, I don't do anymore. We see patient as someone who come as a patient, but we learn about the public health. Patient is the prime, center of the health service provisions. So that's the attitude we need to bring into. A patient is providing opportunity for the provider to think and probably adopt and create new ways of services that can provide solution to the populations. So that's, if we can really change that, people will be more interested to access services and utilizing services in a more motivating way. Instead of getting a prescription, buy the drugs and get well. That's not anymore people believe. So again, social communication is going to be another big part.
I'd like to thank you for your question. I think it's excellent. Ursula, did you want to add?
Yeah, I just want to add that I think that is one of the most biggest problems I'm facing in my everyday life, that the globalized medicine is not existing. I mean, everyone is doing its own thing. Every country has its own regulations when it comes to the pandemic, in special. Do we need a PCR here? Do we need the vaccines there? I mean, there's nothing that's the same. This is what really confuses people. I mean, if the doctor in Great Britain says, you should take this vaccination, it's really good for you, and then they move back to Austria and they say you have to have 3 Pfizer, everything else is not working, and then they move on to Asia and then they say, please, no vaccine, you just have to look yourself up. People get confused. I mean, how can we have trust? How can we just get to people? How can we start communication if we, if we as doctors or as the people who work with it in the medical services do not find a way to really globalize it first? And I think that would be very important.
If I can just add one thing. So with UK, you have NHS. We need something like NHS because our out-of-pocket expenses like 74%. So if I can put a one-liner, we talk about universal health coverage, but we don't know how to get there. So, and it's very, as she said, it's very region specific. So we need to understand what we need more before we can, make a decision for ourselves.
I just would like to add that I think one of the ways that we can actually increase that communication independence is social media. There's a whole hashtag, Twitter. You brought up TikTok. There's so much FOMED, free, open access medical education available, and from what I've seen, that has completely helped with communication about standardizing the way we deliver care in the emergency department. Ultrasound is one of my niches within emergency medicine. It's how we learn from each other on ultrasound techniques. So I think there are definitely negative aspects to social media, but social media during the time of COVID completely opened up our ability to communicate with each other and teach each other, and that's still ongoing. Next question, we had a few hands.
So you mentioned that communication is a big part of healthcare, obviously, like being able to communicate many different types of information so that people know what's wrong and what they need to do. But also the problem with communication and with social media is that you also have a lot of misinformation. Like in the US, you see like a big influx of anti-vaxxers. And so how do you perhaps counter that misinformation, perhaps with the help of the government or NGOs or other third-party organizations? So how can that problem be better ameliorated so that people can actually know correct information and correct treatment?
Excellent question. There's actually a session tomorrow on misinformation.
No, thank you. I think that reminds me how to handle the miscommunication or misinformation in the social media or any media? And this is a very important question actually, because we face the 3 years. People are most, in social media, particularly in Facebook, people share without reading, without understanding information to somebody else. And there is a research done, that's done by Gavi actually, is over 70% of the forwarding messages are really wrong. So that means we have to have a battle. We have to plan strategy in a way that we can counteract the misinformations. And the way it can be done, one is now the digital world. Bangladesh is of course there, and globally we all track everything by the phone. And so that the information needs to be very upfronted and available. That is one thing. Not only the rules and regulation, but also the health tips and information related to that. The second part, which is probably back to us, probably one of our jobs should be in public health, to be more aggressive in communication in a manner that suits to counter the misinformation and also the need of the population as well. And how we do that? We cannot ignore any more Instagram, we cannot ignore any more hashtags, we cannot ignore any more TikTok, and your own personal profile, Facebook as well. No matter what is wrong or right, we have to be there, kind of a watchdog, to make sure that information are provided correctly. One other option is to get back to the generation, which I work to some extent in the school system, and provision of information at the earliest possible time, primary and secondary schools, before the children are putting themselves at risk or in the wrong information. And the communication with them also has to be responsive in that manner, what is appropriate for them. So that it's not all about copying the medical book and sending to the secondary school. That's where the role of communication will be much more serious. Thank you.
Next question.
May I just add very quickly? I think the big problem is that messages that spread anxious things, for example, just spread 10 times quicker than messages that contain healthy information, because it causes anxiety. It works with your emotions. And I do think this working with emotions was the thing we could not see apart. We were just, we didn't know that this is going to happen, that this information will just carry on around globally that quickly. And this led to the big problem that nobody wanted to have the vaccine anymore, because the anxiety was the problem. And how do you just fight this if you don't see it coming? But I think two things happen. First of all, the generation of Instagram now knows that there's a lot of things spread that are not true. And I think also COVID and the pandemic is one reason they know it, because there's been a lot of talks about that. So that makes it easier. I think the people are getting more sensitive if this information is right or not. And we need this. We need this self-insurance and these people who just take their responsibility a bit. Because I don't think there will be the solution that we can just see that there's only right information in social media. I think that will never be the way. But Instagram and social media are in a flow, and we're learning, all of us. We're getting educated, we're living with it. And I think when it comes to the next pandemic, there are not going to be so many people believing everything they see. So I hope this is also one thing that makes it a bit easier.
Hello, good afternoon. Just to give a background, I'm a public health professional in Bangladesh as well. I work for the last mile healthcare worker. So my question is a bit generic in Bangladesh, I would say. We're hearing a lot about communication, about the next pandemic. In Bangladesh, I think the next epidemic would be the antibiotic resistance. And it is not only in urban-centric, it is the last mile, I mean the rural community of Bangladesh as well. There, we already talk about the system. So there are people like community health workers and other like community paramedics. There are tertiary hospitals as well. So my question is that actually what do you think is missing in Bangladesh, that not all the stakeholders are working together to build that network of referral, or to build that system of that the people from the rural communities can go somewhere and they can go upwards to the specialists, or they can have a good telemedicine or a referral. I mean, whatever the system is, what is actually missing to connect all these dots or all these stakeholders in Bangladesh? So that would be my question. And if there is any difference in Austria and other countries, please feel free to share. Thank you so much.
That's a very good question. And that's where I feel, you have to make policies. You have to make a lot of policies that are also made mandates. That's where the referral system comes in. And we are always talking about GP system, like general practitioner healthcare, because we also see in Bangladesh, nobody talks about it, like doctors are busy. And we don't have that gatekeeping system of somebody going not to the GP, but directly to the specialist. You might just have a cough or cold, but you end up coming to a respiratory specialist who's probably like an ICU worker. And that's where that gatekeeping mechanism is needed. That's why these policies are needed. But we have constraints in healthcare workers, the workforce especially. We have just like maybe 5.6 doctors for 10,000 people. And if you want to make that from the last mile up to the tertiary hospitals, if you want to make that difference, that segregation, you have to have policies inbuilt. You have to have that gatekeeping system where telemedicine can come into play. The telemedicine refers that particular, if we can modernize our healthcare workers who go from door to door to create the awareness, which Bragg did many decades ago and which is ongoing. If we can make smarter healthcare workers who have devices and who goes door to door to the last mile, and then from there, from the community clinics as well, we have a referral system that sends them to the specialists, but we don't have that in place now. So you have to have that layer. That layer is required before we can think, and a very good question, the antibiotic resistance. That's also there. People have access. We don't have prescription, like in all the Western countries, you don't have access to medicine. You have to have a prescription. So that also needs to be, I think they're talking about it now, that you cannot just go out in the pharmacy and buy your antibiotic. And people, the rural people, they have this mentality that, oh, I'm sick, I need that medicine. So along with that prescription-based, that system generation, we also need to make awareness. They can't be just having these medications. These are life-threatening eventually. It can cause more kidney failure, liver failure. So it's a lot of work still needs to be done, but awareness are being generated now. So I guess.
Okay, I think this is one of the most important point that I forgot to mention. The world is not Bangladesh. The world is going to face the antimicrobial resistance. And there are many countries in the world, they are regulated and doing very nice in terms of drug management. We're worst in Bangladesh, in Asia as well. One of the things I said nowadays in different forums, there are so many good lessons we learned from COVID. There are bad lessons also in COVID. Health awareness has increased, but everybody got to be a doctor as well. So no one need to go to a doctor. They prescribe by themselves. They try to get the medicine from the shop. If it is available, if not available, they try to find a way out. So what it means actually, one is the regulation is there. Like in Bangladesh and Asian country, I was in India, I was saying the same problem. Regulation is there, so regulation we need it, policy, but we need the community awareness and understanding that utilization of the drugs is going to, we talked about non-communicable disease. And many of the things like in Bangladesh, you know that drug-resistant tuberculosis in Bangladesh is increasing, which is a very, very unfortunate thing. We have done so good in tuberculosis management and declining the mortality and detection rate, but now we're getting the drug-resistant tuberculosis. Similarly, there are many drugs already not going to work. Many of the antibiotics is not going to work. There is a study just published from India, AIMS, in All India Institute of Medical Science. From the ICU report, out of the 10 ICU patients, 6 are not working any antibiotic. So you can imagine how exposed situations are there. I guess in Bangladesh, we do not have that kind of very specific research, but I would expect a similar kind. So the part is, there is a strong advocacy, of course needed, policy to go. But I would go back to the school and the village again. Because until unless we give the power to the hand of people, we will not be able to progress much. So people will need to know actually for what reason they are going to buy the drugs. And also drugs should not be available as it is in South Asian country like Bangladesh. And of course the other health workers, the government, NGOs, and social workers, And why not the Lead Fest champions and influencers are be part of it? And that is why health matters in Lead Fest.
We have time for one more question.
Thank you. Thank you for the nice talk. I'm a medical student from Dhaka Medical College. Actually, we had a nice talk on how communication can impact the communicable and non-communicable diseases. And here Dr. Malia was talking about how our nation has combated diarrhea just by a single message of one fistful of sugar, molasses or sugar or salt. But I think from the recent statistics, should we go again to the schools and villages about communication of some emergency conditions? For example, in my hospital, what I see, so many patients come after a stroke with lifetime paralysis. But as we are medical students or doctors, we know, if he or she can diagnose the stroke signs within 4.5 hours in ischemic ones and can start the reperfusion or antithrombolytic therapy, he or she can easily get cured. Or in my medical curriculum in Dhaka Medical, I have passed about 3 years, but my medical college didn't teach me how to give a CPR. So actually, should we put more focus on this, on how to understand some emergency conditions and how we can make public health literacy on conditions like cardiac arrest or stroke, and whether Dr. Mizan can tell us how Shastha Batan can help us, the telehealth initiative. And as Dr. Malia is working on school health programs, can we integrate these emergency conditions and how to treat them in the textbooks of school curriculums so we can see another revolution like diarrhea in these diseases also? Thank you.
So if it's okay, I'll start. You maybe have seen some of the recent incidents on the news of sports in the USA, of a few athletes dropping on the basketball court and on the football field, the American football field, from cardiac arrest. And in all these cases, the quicker CPR is performed, the greater the chance that the person survives, does well, and has an intact working brain. So I think your question is almost intuitive. I think all of us would say, yes, of course we should educate, of course we should get it out there. And the question is often how. And one of the things I wanted to bring up is something that I think is one of the ways forward for all these questions. It's called health design thinking, where you have the end user, that could be the patient, that could be the physician, that could be the caregiver at home, at the table as you're creating the solutions. Because when it's diabetes, blood pressure, gut health, and people will say, that'll never work for me. I'll never be able to have 3 meals a day. Or they'll say, it's impossible for me to not overeat. And by having the person intended, again, the patient, the end user in mind, help designing a process, help designing an education program, help designing a device, you'll end up with a better solution. It may not be the best, it may not solve everything, but it's definitely that iterative process of the health design thinking and framing and having people at the table, people from Dhaka Lit Fest, people who are not physicians, people that are designers, people that know how to illustrate and create graphics. There are so many people that you can have at the table to help design solutions to these problems, to these education initiatives, so you're better off. But I'd welcome all of you to help answer, but I think the answer is yes. Of course, we want everybody to educate. We need to get it to schools. We need to get it to people. Citizen CPR. When you're walking through the airport, you can grab an AICD and put shocks on people, but that education piece is important.
And I do think the awareness of wanting to have this information is bigger now. It was very unsexy to say it, to talk about health issues before, also in the younger generation. And now I think people are more aware of their health. And I think we should use the ways to get the information there that people use. And that is, for example, social media. So we cannot cancel that out, because I do not think that the normal ways of transportation will really affect the youth. So for every age septum, we need different ways, but really better.
Thank you for raising this question. It's very valid. Initially, we talked about like why this year. I'm so shocked by the beginning of the year. I said Happy New Year, but in the public health, very shocked in Bangladesh. 43% of adult population living with hypertension. It's not acceptable in public health, and we know the consequences where it is going to. So what you mentioned, that's absolutely correct, that we need to get down there, also changing medical curriculum, but also including information, basic information, life survival medical information at the possible outlet level. Idea is not everyone to come to the doctor. Idea is to protect by our own as much as we can from the messages that we learn. But also, the reason why I mentioned Lead Fest, because people need to be really, mental health, if it's not healthy enough in terms of songs and musics and poems and talking to friends, disease process, you're in Dhaka Medical College, you know very well. Disease process do not really follow always medicine. They listen to social medicine as well. That's why I call social medicine is very, very important for living with a non-communicable disease. And we all need to prepare for ourselves that the next world, which is now the next 5 years' time, I said, we should not be all become a doctor, but we also do not need to need to go to a doctor as well. So that our basic rights is to know how to make ourselves healthy. And I would never say eat less and do physical exercise. I would say whatever you love, eat, but more, but more.
I'd like to thank all of you for these excellent questions, for staying here with us. We've reached time, so please give a big round of applause to our panel.